There are enough studies which have shown that the agarbatti smoke can also result in a lot of lung damage.
Perfumes are one of the biggest factors of indoor air pollution.
Absolutely.
Someone told me carpets. Is that true?
Your heavy carpets, heavy furnishings, heavy curtains, bed covers, bed sheets, they all trap a lot of dust. Degree of damage air pollution can do. It is actually called a silent, invisible killer.
So lesser the furnishings, the better.
Absolutely. Morning walk in winters you should go away from completely because the smog levels are the highest, the AQI levels are the worst. Barack Obama had come to India. 3 days that he was here, when he went back and an analysis was done, they actually realized that his life expectancy had been reduced by 2 hours per day. There are studies shown that our life expectancy in India has gone down by, some say, 12 years. According to the statistics, in 2019, 1.8 million deaths in India alone because of poor air quality. If you travel to London, New York, these places, the AQI levels are only 4, 5. For us, 100 is like, okay, that's like a usual day. How many times in a day do you really breathe? Almost about 24,000 times in a day. Imagine the quantum of air pollution you're actually taking in your lungs in one day.
Dr. Vivek Nangia is India's leading pulmonologist, renowned for his work in respiratory medicine, critical care and sleep disorders. Trained at Stanford, Royal Brompton, UK and Spain with a master's in infectious diseases from the London School of Hygiene and Tropical Medicine, he has set global benchmarks in pulmonary care.
These days we have fancy air purifiers. Do they work? Vaping is worse than smoking?
Vaping damages you instantly. There have been many deaths that have been reported because of vaping. Passive smoking is something again which is like a silent killer. More than 4,000 toxic particles which can produce cancer in the body. Cancer anywhere from the lips to the tongue to the throat to the food pipe, windpipe, right up till the urinary bladder. 1 hour of a session of shisha is equivalent to 100 cigarettes.
Would the sleeping posture affect your breathing?
If your posture is not correct, the breathing capacity of the lungs could be reduced by nearly 30%.
If I am a recurrent snorer, then I have to get myself tested.
Absolutely.
When people have blocked nose, they use these Vicks inhalers. Is that safe?
Currently Chief of Pulmonology at Max Healthcare and Vice Chairman of the Institute of Respiratory Critical Care and Sleep Medicine at Max Saket, he is also one of only 5 doctors worldwide and the only one from India honoured by Her Royal Highness Princess Royal of London. It is our privilege to welcome him on today's episode of the Body to Being podcast, Dr. Vivek Nangia.
25 micrograms of PM 2.5 is equivalent to smoking 1 cigarette in a day. So if the PM 2.5 levels are say 100 on any day, that means that has been equivalent to smoking 4 cigarettes in a day. You should not be brooming. You're actually moving the dust from the floor into the air. If your snoring can be heard across the wall, across the room, then you must get yourself tested.
Because it could possibly kill me.
Absolutely.
Did you know that breathing in metros such as Delhi and Mumbai is akin to smoking 5 to 7 cigarettes a day? Or that indoor air pollution is 5 to 30 times more harmful than outdoor air pollution? Surprising, isn't it? Oxygen bars in Delhi are being sold at 300 and 500 rupees just for 15 minutes worth of oxygen. An ironic sign of how unbearable air pollution has become. It is no wonder that lung cancer is the leading cause of cancer deaths in the world. Globally, 1 out of 5 cancer deaths is due to lung cancer. Are your air purifiers and masks really working? Because now the real danger isn't just what's out there in the air, but it's how your lungs respond to it, because your lungs are your body's first line of defense. And when they get compromised, everything from your hair, skin, immunity, mental clarity, sleep gets compromised. In today's masterclass, we're going to deep dive into lung health. But before we begin, I have a little request. We are one of India's leading English language channels when it comes to healthcare. You can support us by subscribing to our channel, sharing this video among others. You can also directly contribute to our foundation. The link is in the description. Namaskaram, Dr. Vivek Nangia. It is a pleasure to have you on the Body to Being podcast.
Namaskaram, Shloka ji. It's really my honor and privilege to be here for this podcast, truly.
How are you doing?
Very well, thank you.
A topic of such nature has been tackled for the first time in our podcast, Need of the Hour. So let me begin at the outset by asking you, what are some of the very unusual, fascinating, unique insights that you can give to our viewers about the human lungs, about breathing, etc.?
So let me start with describing what the structure of the lungs and the airways actually are and how do we really breathe. The main function of the organ that is the lungs is breathing. You can stay without food, without water for days together, but you can't stay without breathing for more than 3 minutes.
3 minutes is the upper limit.
3 minutes is the upper limit. So you really need to know the importance of this organ, which is actually sustaining your life. The fascinating part of the lung is that, if I was to ask you that how many times in a day do you really breathe in and out? You wouldn't know because you've never really calculated. This is something that happens at an involuntary level, at a very reflex kind of a level.
Correct.
But if you actually see, you breathe about 14 to 15 times in a minute, 60 seconds in a minute, and 60 minutes in an hour, and then 24 hours in a day. So if you multiply 14 into 60 into 24 hours, the figure comes to almost about 24,000 times in a day. And with each breath, an adult takes about 450 to 500 ml of air going in. So imagine the quantum of air that you're breathing in and out. And especially if it is polluted, imagine the quantum of air pollution that you're actually taking in and out of your lungs in one day. Compared to the amount of water that you have, compared to the amount of food that you have in a day, how much of water? Probably about 1.5 liters, 2 liters, 3 liters is the water that you would be taking, or the total liquid content. Right. But air, it's humongous amounts that you're taking in and out. And especially if it is polluted, then you can imagine the amount of damage that you're doing to your body in one day itself.
You mentioned that, people who are not, who don't fare very, very well when it comes to their lung health must not step out when the AQI is of a certain number. But what about indoors? Are we then shielded from the bad effects of air quality if you're indoors?
So on the contrary, there are studies which have shown that the AQI levels inside homes, indoors, indoors, is about 10 to 30 times higher than the AQI levels outside. Indoor pollution can be much higher primarily because it's all closed doors sometimes. So the moment you open the door and the window, there is air pollution coming from outside indoors, and then when you close it, then it stays inside. Apart from that, there are so many other sources of indoor air pollution. If I was to start naming them, first and foremost would be the pets that people have in the house. You and I, when we go out, we wear something we wear footwear and go out, while for the pets, there are no footwear. So when they come back, they carry a lot of dust with them. Their own dander, urine droplets, salivary secretions, and all of that could be causing pollution in the air. Then your kitchen smoke, when you're cooking, if the chimneys are not working properly or the exhaust fans are not proper, all that smoke, faulty equipment lying in the kitchen, dampness inside the houses, especially in the basements and the washroom areas. We get lots of patients. In fact, recently we had a patient who had developed what is called a hypersensitivity pneumonitis, where, the lungs start getting affected and many of them go into an irreversible stage. It may not even improve despite all your medication. And this was an architect family where the moment I asked them that, do you have any dampness in the house? And the entire family said, yes, Dr. Nangia, we do. And they realized that there was dampness in their bedroom itself. And they had to get the bedroom shifted and get that entire wall repaired once to, get it rid of all the dampness and the seepage there. So dampness can be a very major factor that could result in indoor air pollution. Apart from that, what we don't realize is when we are lighting all these agarbattis, dhoops, they're also emitting a lot of smoke, which again remains indoors and doesn't move out of your rooms. Havans, we, especially people who are Arya Samajis, they tend to perform a lot of havans in their houses. What we forget is that, of course, it's a good tradition to have havans in the house. But in the yesteryears, when our grandparents and all used to have havans, they would do it outside in the courtyards, never inside the houses.
Correct.
Havan produces a lot of smoke, of course. I'm not being anti-religious here. I'm also an Arya Samaji myself, and I would have also done havans at home, but I now realize that we are actually harming ourselves by doing all that. Lighting dhoops, lighting agarbattis, there are enough studies which have shown that the agarbatti smoke can also result in a lot of lung damage. Apart from that, use of very strong fragrances, use of all of these
Perfumes. Perfumes are one of the biggest factors of indoor air pollution.
Absolutely. Insecticidal sprays inside the houses, your anti-mosquito coils, all of those emit a lot of volatile organic compounds, which can also be allergenic in nature and can damage the lungs.
Someone told me carpets. Is that true?
So carpets, heavy furnishings, your heavy carpets, heavy furnishings, heavy curtains, they all trap a lot of dust. So this is very ironical. I'd like to share with you. So, there was this office I was told in Delhi, which is a completely green office, and they have green plants, and the AQI level is 0, and where they have HEPA filters and everything inside the building. So I was called there for a meeting. This was one of those days, early days when pollution awareness had just started. I think sometime around 2014, 2015. So I went into this office, and the first thing that I enter is into a lift, and the lift is full of stench. It's because it's all damp from everywhere. It's a wooden lift where you can actually smell the dampness in that lift, which in itself is counterproductive. Then we go on to the 4th floor of this building, which is supposed to be a green building, and there are carpets which have not been cleaned for months, which are trapping all the dust inside. So bed covers, bed sheets, they all trap a lot of dust. And especially if you're allergic to house dust mites, then you're in for trouble. That is something that you should be avoiding completely. If you have allergies, if you have asthma, then heavy carpets, heavy furnishings, heavy bed covers, they should all be avoided.
So lesser the furnishings, the better.
Absolutely. So you should actually be going in for something like vinyl flooring, tiles on the floor, which don't trap dust. You should not be brooming. It should mostly be wet mopping or vacuum cleaning the house.
Acha.
Because in India, we have the concept of jhadus a lot.
Yeah.
Jhadu, common sense, when you're moving the jhadu, you're actually moving the dust from the floor into the air. And then that is what you're inhaling. So that would definitely result in allergic kind of conditions or breathlessness, wheezing, all of that.
How do I prevent this A when I'm indoors? Because these days we have fancy air purifiers. Do they work?
Okay, so let's start with how do I prevent this? And then we come to air purifiers. So first of all, as I said, you have to treat the root cause. Root cause, if it is the pets, you need to find a solution for that. Avoid heavy carpets, heavy furnishings, dhoops, agarbattis, all of that.
The organic ones are fine, na?
Anything that is emitting smoke cannot ever be fine.
But a lot of it, camphor, for example, is used in a lot of Ayurvedic medications.
Yeah, but camphor again, if you're lighting it and it's producing smoke, it is emitting volatile organic compounds into the air. And that if you're inhaling, they're likely to cause an inflammation inside the lungs. The degree may vary, but then it would cause some degree of inflammation inside for sure.
Okay.
So take care of dampness in the houses. So there's this very interesting case that I think I should share with you here. This, very senior executive from one of the companies used to come and show me for his cough. I would give him medication, but his cough would not go. And then in between, he would travel abroad, his cough would disappear completely. Whenever he would come back to Delhi, he would have cough. So initially, we kept attributing it to Delhi's air pollution. How these patients are, they would keep asking, Doc, why is it not going? Why is it not going? For me, also, Delhi's air pollution was the easier route out. So I would tell him, okay, sir, it's basically because of the pollution, that it's not going. So you think of shifting out somewhere. So he was almost on the verge of, changing his job and shifting out to another city. When incidentally, I was just crossing his office one day and I happened to just drop into his office. I said, okay, I'll have a cup of tea with you. So I went inside his office. He was sitting and we were just chatting. And he just turned around to pick up some books and show me, that he just wanted to share some books with me. So the moment he turned around to open his cabinet, there was such a strong stench of, dampness there. And I told him, boss, it's nothing else. It's this office that is causing you the problem. He said, Dr. Nangia, you may just be right. When I don't come to office for a week, 10 days, I'm quite all right. But the moment I start coming here, again, I develop the same cough. So we got his office changed. And ever since then, it's been like 4 years, 5 years, he's never come back to me for cough. So, treating the root cause is very, very essential. Identifying that first of all. So you need to spend time with the patient, try and figure out why is it that it's this relentless cough is not going. So indoor pollution, this is one of the major reasons that you need to focus on. Apart from that, I guess you can have exhaust fans, chimneys inside the houses for proper ventilation. You could have some indoor plants as well. There's this mother-in-law tongue plant. Then there's this ferns, bamboos, snake plants. They are ones which convert carbon dioxide into oxygen as well. So they are beneficial. Besides purifying the air, they also help you with this. So these are the general measures that one can take. Apart from that, you were talking about air purifiers. Now, are air purifiers a fad, fashionable, fashion statement? What are they? Sometimes you feel that when you were kids, you used to live with coolers in the houses. Then a time came when ACs became essential for all of us. Now, is it that air purifiers have also become essential? Do they really make sense? So my argument to that is that we're spending 80% of our time indoors. If you see, this is also indoors. Homes are also indoors. Your offices, your schools, universities, colleges, places of work, malls, they're all indoors literally. Out on the street would be probably a couple of hours in a day. So if you were to breathe good air for those hours that you're indoors, does it not make sense? If you are drinking one glass of contaminated water in a day and rest of the time you're drinking clean water, this is the same way that if you're getting to breathe good air, even if it is for 8 hours in a day at night when you're sleeping, okay, your office environment may not be under your control. When you're in the mall, it may not be under control. But again, there are malls in Delhi now which claim to have zero AQI levels, or at least bare minimum AQI levels. So what is the harm? I don't see any harm in using air purifiers in the houses. If you can afford it, then use it. If people have an underlying asthma or a chronic obstructive pulmonary disease or any other disease which is getting triggered off by the indoor air pollutants, then there's no harm in using an air purifier at home.
But do they completely eliminate the air contaminants?
So no, that may not be possible, because ultimately for that you need to have a completely sealed room from all sides at all times, because the moment you open the door, again, there would be air coming in. But I always argue that, whatever you can, what is the harm? If you can afford it, then why not? It is not something that's harming you. You could even have air purifiers, HEPA filters in your air conditioners. In fact, I use a HEPA filter in my own car. And the day the air purifier is not working in the car, I've actually seen the difference. The moment you enter into the car, the AQI level is around 340, 350 without the filter on. And the moment you switch it on, after about 15, 20 minutes, the AQI levels actually come down. You can see that
Come
happening.
down to how much?
To about 30, 40.
Okay, acha.
So...
And the ones at home, they would
The
filter
ones at home, because it's an ongoing process, it's a dynamic process. The doors are opening and shutting all the time. So in them, it's difficult to control it.
When you say opening, meaning the room in which you host the air purifier.
Yes, exactly.
But these days you get centralized air
Absolutely.
purifiers.
So there's no harm.
Okay.
So I know of houses where they have literally zero AQI levels.
Okay. So that is possible.
That's possible.
Okay, you
of
can
course.
completely eliminate the air contaminants.
Yes, completely you can.
Okay. What are some of the unique insights that people may not know about, let's say, breath or lung capacity or oxygen?
So basically, I feel that, as far as lung capacity and oxygen is concerned, people tend to underestimate the importance of lungs, because the lungs get affected even by very small particles. Particle size which is less than 5 microns, which is not visible to you. When you talk about water contamination, you can actually see water that you're drinking. Is it clear or not? You'll
Correct.
be able to see.
Yeah.
But air, because the particulate matter is less than 2.5 microns, the one which is damaging your lungs. So you really don't get to know. Similarly, for the respiratory viruses, you really can't see the viruses or the bacteria in the air that you're inhaling and exhaling all day long. So the defense system of the lungs has to be very good to be able to fight out all these bacteria and viruses and the pollutants in the air, so that you're not affected. Ultimately, you have to understand that the lungs are also, their lungs are studded with the various immune cells, some of them lying permanently inside the lungs to be able to combat all these allergens, toxic agents, to protect you. So lungs also act as a huge defense mechanism to prevent you from catching infections.
They're the first line of defense, right, in our human
Absolutely.
system?
When you talk about the particulate matter, you would have read all these in newspapers, in magazines, in journals, where they talk about the sizes of particulate matter. So what is the significance of that? Have we really thought of it? The particulate matter, PM10, PM5, PM2.5.
Yeah.
What does it really mean? When we talk about air pollution, there are two parts to the air pollution. One are the toxic gases, like your carbon dioxide, nitrous oxide, sulfur dioxide, ozone, lead, ammonia. These are some components. Another component is the particulate matter. Particulate matter is the suspended matter in the air, which is of different sizes. The larger the size, the lesser likelihood that it is causing you any damage. So PM10 is not a particle which you can inhale inside. That would get filtered at your upper airway level itself, like nasal level or the throat level. So maximum it can cause is some kind of nasal congestion, sore throat, heaviness in this upper part, itching in your eyes. That's the usual that a PM10 particle can cause. But a particle size less than 5 microns is the particle which goes into your lungs. A particle size less than 2.5 microns is the one which goes right across the alveoli also, the air sacs as well. And something less than that would get absorbed into the bloodstream directly. So, the smaller the particle, the more toxic it can be to our body.
Acha. Ah.
So that is why you see the relevance of PM 2.5 when we calculate the AQI.
Yeah.
Or when we see the AQI. One is the AQI is a generic term which is based on certain calculation that is done depending on the percentage of all these gases and the particulate matter. But amongst these, PM 2.5 plays a very major role. So 25 micrograms of PM 2.5 is equivalent to smoking one cigarette in a day. So if the PM 2.5 levels are say 100 on any day, that means that has been equivalent to smoking 4 cigarettes in a day.
Aha. So there was an article, I think, way back in May 2018, which said that if you're living in Delhi, then it's equivalent to smoking 7.7 cigarettes
Absolutely.
a day. And I think as per some older health index, if you're living in Bombay, it's equivalent to smoking 4 cigarettes a day.
So that would all depend on the level of the PM 2.5 literally and the AQI levels outside.
What AQI is basically the air quality index for the viewers.
But again, this is not a problem only for Delhi. It's the entire Indo-Gangetic belt that is affected.
Yeah.
Right from Delhi, Agra, Kanpur, Lucknow, Meerut, all these cities.
What is the AQI that we should be wary of as individuals?
So what we need to see is that WHO standards are very, very strict as far as the AQI levels are concerned, but we are a little more flexible with it. So we keep 100 as our cutoff. That okay, up till 100 is okay, whereas WHO would consider 50 as their cutoff. And in fact, there are other countries where, if you travel to London, New York, these places, the AQI levels are only 4, 5. For us, 100 is like, okay, that's like a usual day. It doesn't really matter. Our bodies have become a little resilient to that. So anyway, having said that, so what you need to know is that when AQI level is more than 400, that is like an emergency. That is a situation where nobody should be moving out at all out of their houses. Should be completely indoors and move out only if very, very essential. If the AQI level is between 300 and 400, then what I suggest is that for people, healthy people, they should be restricting their outdoor movement to as little as possible, but not be involved into any kind of strenuous physical activities like marathon, cycling, exercising. That should all be done indoors. And for people who are vulnerable, like people who have an underlying lung disease, asthma, COPD, heart disease, stroke, diabetes, and those youngsters, elders, the extremes of population, these people are considered as a vulnerable group. So for them, 300 should be the upper limit, whereas for a healthy individual, 400 should be the upper limit. So between 200 to 300, the healthy people could be moving out, maybe exercising a bit. But those who are vulnerable, this high-risk group, should not be performing any kind of strenuous physical activity outdoors. So they should be, for them, minus 100 is the cutoff limit that I would suggest. So that is how in fact, a time has come where we should decide our day-to-day activities based on the AQI level outside.
Okay. And how do I test for vulnerability? A is that I could be diagnosed, but what if I'm not diagnosed?
Well, yes. So if you have any symptoms, you should consult your physician immediately. Any symptoms of cough, breathlessness, chest tightness, fever, loss of weight, appetite, those are the usual symptoms that you would encounter if you have a lung disease. So blood in the sputum. So if you have any of these, then you should consult your physician immediately.
Which is the best state in India, as per you, which would have the best AQI?
Probably Goa.
Yeah?
Yeah, Goa would have the best AQI there.
Okay.
So all these southern states where there are coastal areas, there of course the AQI level is better.
Why is that the case?
Because of openness. Like in Delhi, it's all landlocked. So anticyclonic waves and all of that, they tend to create a kind of a situation where the particulate matter is trapped at the level of closer to the earth level. So it doesn't allow it to, escape from there.
Okay. And the worst months through the year where the AQI would be worse, I'm assuming around Diwali?
Absolutely. So starting now, October onwards, October till sometime around February, March. Morning walk is something that in winters you should go away from completely, because morning is the time when the smog levels are the highest, the AQI levels are the worst. So that is the time you should avoid. You should only be going out when it's nice, bright, sunny outside. And that is when the AQI levels will be slightly lower. I don't know if you remember or not, but in 2015, the then president of USA, Mr. Barack Obama, had come to India for the Republic Day parade, He came on 25th and left on 27th. Those 3 days that he was here for, the AQI, the PM 2.5 particle levels was something between 75 to 85, not very much according to our standards. But when he went back and an analysis was done, they actually realized that his life expectancy had been reduced by 2 hours per day because of that AQI level. And imagine for how long would he have been outside, breathing that air. I don't know if you've heard of the major debacle of how all this about air pollution really started was way back in 1952, the London smog, as we call it. It was between 4th December to 8th December, from a Friday to a Tuesday, 4 days, when that was also the time when it was more of an industrial revolution that was going on in the world. The reliability was more on the charcoal for all the power that was generated. And it was one of those windless days, anticyclonic kind of conditions, chilled winter, 4 December. We know in London how the temperatures would be so low. On those 4 days, there were 4,000 deaths because of the air pollution. The AQI levels had gone up so much then. Of course, they didn't have enough. They didn't have the science and the technology to be able to measure the AQI levels. But if you see the pictures of London smog 1952 then and what we see now, it's very similar, believe me. So 4,000 deaths, which were later calculated that probably the number was 12,000, and about 1 lakh of people developing lung problems within those 4 days of exposure to the pollution. That is a degree of damage that the air pollution can do. It is actually called a silent, invisible killer, but this is something now is quite visible to all of us. It's just that we are getting used to it by, just by seeing it day in and day out. According to the statistics, in 2019, there were about 1.8 million deaths in India alone because of poor air quality. And these deaths were not because of only lung condition. Of course, lung cancer and lung condition were two major indications, but also because of heart attacks and brain strokes. So the air pollution or the inhaling the polluted air is harming not only the lungs, but also our heart, our brain, and so many other organs of the body. Various types of cancers, allergies, asthma, COPD, hypersensitivity pneumonitis. These are some of the conditions that happen in the lungs in the adults. Then it can cause a heart attack, heart failures. It could cause brain strokes. There are studies from our own country, from some of the renowned institutions of our country, which have shown that as the AQI levels worsen, the number of hospitalizations with acute asthmatic episodes, with acute heart attacks, increases by nearly 20%. And these are not studies of recent times, but older studies. So there is enough evidence in the literature to say that air pollution is really harmful and can lead to mortality. There are studies which have shown that our life expectancy in India has gone down by, some say 2 years, some say as much as 12 years. So the difference in the numbers is also humongous. And the impact of air pollution is not just on adults, but it's worse in children and even pregnant ladies. Even before a child is born, even when the child is still in the womb, even then they could have intrauterine growth retardation, poor lung function developments. After birth, the children could develop allergies, and these toddlers who are crawling on the ground, if they're inhaling dust, they could even develop mental retardation and those kind of things. Apart from asthma, respiratory tract infections, tuberculosis, so many side effects that a polluted air can have.
Do masks really work?
Masks. When you talk of masks, you need to understand that the only mask that would work is an N95 mask, not the usual cloth masks or the usual surgical mask that we are used to seeing.
Yeah.
Second thing is that even the N95 mask, why is it called N95? Is because it is able to filter out 95% of the particulate matter 2.5 and above. So it only targets the particulate matter but not the toxic gases. It would only prevent you from PM 2.5 particles, that to 95% of them. There would still be some that would be going inside the lungs. So unless you wear those industrial grade masks, which provide you like a 99% protection, otherwise there's no protection to it.
Okay. You talked about smoking. And when I was having a call with you earlier, you mentioned that there are far more deaths due to passive smoking. And I believe it's 1.3 billion in India, right? Tell me about this, sir, because people know conventionally that it is the cigarette smoking that is injurious for health. But what about vaping? Some say vaping is better, maybe BDs are better, and there's shisha. There are all of these other allied ways of, getting high or feeling good. What would you have to say about that?
So if I was to answer that in one line,
Yeah.
None is better than the other one. One is worse than the other one, actually. So that is the
Vaping
bottom
is
line.
worse than smoking?
All of them are equally bad, some way or the other, and we'll discuss that now.
Sure.
So let's start with second-hand passive smoking, as you said.
Yeah.
So, passive smoking is something, again, which is like a silent killer, I feel, which you feel is innocuous, but is actually harming you more than what you expect. And it isn't harming only the adults, but also the children in the family. So, what you need to understand, when somebody smokes a cigarette, he or she only inhales 1/3 of it inside, and 2/3 of it comes out. Again, one, because of the burning itself, and two, because you tend to exhale out. When you exhale out, the entire smoke comes out. So 2/3 of it is in the environment around you. Now, whoever is in that environment where there are smokers, they're obviously inhaling the same air, whether they're children or adults. So they're harming themselves. We must know that there are more than 4,000 toxic particles or gases in the cigarette smoke, out of which 50 or more are those which can produce cancer in the body. Smoking is very, very harmful.
So it's not underrated. When they say smoking is harmful because people say, right, but I only do it socially or I do it sometimes.
So there's nothing like socially. Once you start smoking, then you're smoking. And you need to calculate your pack years. If somebody has more than 20 pack years, then the probability of lung cancer goes up stupendously. So when I say pack year, it actually means if you're smoking one pack of cigarettes, that means 20 cigarettes in one day for 1 year, that means one pack year. So if you're smoking, say, 2 packs of cigarettes every day for 10 years, that would make 20 years, 20 pack years. So anything above that is very, very dangerous. But even less than that doesn't mean it's safe. It's still harming you. And the harms of cigarette are way beyond that you can even realize. It's not just lung cancer or not just asthma, COPD, but it's cancer anywhere from the lips to the tongue to the throat to the food pipe, windpipe, right up till the urinary bladder, stomach. All the organs can get affected because of cigarette smoking. This is the extent of cancers that it can cause.
Even if I'm smoking moderately?
Let's not forget that it's not just smoking. There's smoking, there's air pollution, there's a genetic predisposition, so many other
It's the whole
factors.
ambit, yeah.
It's a whole ambit actually that is causing all this.
But लोग कहते हैं कि my Dadaji lived for 100 years, he smoked BD every day, nothing happened to him. We are going to get comments of such nature. What would you have to say to
So
them?
BD is even more harmful because BD does not even have a filter in it. And it is not processed properly. The tobacco that you're using is not processed properly. So BD is even more harmful. I wouldn't remember there's an index that you use to calculate how many BDs are equivalent to one cigarette. But yes, it is worse than that. We talked about all the types of cancer that it can cause. Apart from that, it can cause stroke, brain hemorrhages. It can cause heart diseases. It can cause what is called peripheral vascular disease, where the blood supply to the legs gets cut off gradually. And it can cause even diseases like diabetes, hypertension can also be affected because of smoking.
Even if I do it occasionally, even if I do it in moderation, it doesn't matter.
Absolutely. There is no cutoff, that, okay, if I'm smoking, say, 5 cigarettes in a day, I'm good. No,
Or
there's
once a
nothing
week.
like that. No, it doesn't matter. Smoking is smoking. You may be damaging yourself to a different level, to a different degree, depending on the number of cigarettes being smoked per day. But of course, damage is definitely there.
But is it a given that cigarette smokers will live less than a non-cigarette smoker?
So basically, because it is triggering off an atherogenic process in the body, so atherosclerosis levels will certainly be higher. So definitely there would be impact. It's like drinking alcohol. There are people who may just damage their liver with drinking alcohol in, say, within 5 years of drinking, and the others may be drinking for 50 years and still not getting damaged livers. So there is no ballpark figure kind of a thing that, okay, this much is dangerous. But yes, we know that 20 pack years and above is extremely dangerous.
Okay.
There's something called bronchoscopy. Bronchoscopy, like you do the endoscopy of the stomach, you do the endoscopy of the lungs is called bronchoscopy. So as I described in the beginning that there are these airways. So we have an endoscope, which is like a camera at a distal tip and then a flexible kind of a tube that we introduce from the nose or the mouth and go into the windpipes. So what earlier we would see, or in youngsters you would see, are pink airways inside. Now when we do their bronchoscopies, especially in elders, especially those who've been smokers, you find black patches, the carbonaceous deposits inside, as we call anthracotic patches inside these airways. So they're no longer that pink airway that we used to see. In smokers especially, they're all darkening inside in the airways.
But, people also say your lungs have a natural capacity to heal. It may heal over time. Let's say if I go cold turkey, I've smoked for 10 years, 12 years, 15 years. I go cold turkey. Will my lungs start healing themselves?
Yeah, very good question. So healing does not happen over days or months. Healing happens over years. So when you stop smoking, whether it's cold turkey or the gradual way of quitting smoking, whichever way you do it,
Yeah.
when you stop smoking finally, then within 24 hours, the pulse rate, the heart rate, all that comes back to normalcy. Within 1 to 3 months, lung functions start to recover. Within 10 years, your risk of developing lung cancer reduces by half. If you were an active smoker versus you've quit smoking, 10 years from then, your risk factor for developing lung cancer reduces by half. At 15 years, after you've quit smoking, your chances of developing a heart attack are equivalent to a non-smoker. So that is the time frame that you're looking at after you've quit smoking for recovery from the ill effects of smoking. Shisha, which has now become a fad, you would have seen that happening in parties as well. There are proper agencies which provide you a shisha at every party. They would come and do that for you. 1 hour of shisha
Shisha is
smoke.
different from hookah?
Shisha is very similar to hookah, what our
Okay.
grandfathers and forefathers used to
Yeah.
do. And I'll come to that. Shisha, basically, when you're smoking shisha, 1 hour of a session of shisha is equivalent to 100 cigarettes. Inhalation of smoke is equivalent to that. Now, what happens? What is shisha? Shisha is basically nothing but heating up nicotine using charcoal. Charcoal is burning to heat up the nicotine that you're then inhaling inside. So, it liberates certain polycarbonic compounds also. One of them is called benzene, and benzene can actually cause leukemia, the blood cancer, to people. So apart from that, the stub that they use is something that they keep exchanging, between people. You just take it out, wipe it, start using, somebody else starts using it. What they don't realize is that when they're sharing hookahs and these stubs, they're actually inhaling infectious agents of one person to the other. If supposing I have tuberculosis today, I may not be declaring that when I'm going out in public, or maybe I'm not even aware of it. Most of the diseases are communicated before you get aware that you're suffering from an illness. So you may just be inhaling in the same hookah and then sharing it with other people who then inhale the same, use the same stub to inhale it. And you're very prone to developing infections as well. So apart from the usual complications of a cigarette smoke or inhalation of smoke, this is an add-on complication that you can develop by shisha. And I've actually seen patients who have developed tuberculosis after, going into these shisha sessions.
Oh, okay. Okay. And what about hookah?
Hookah is equivalent to shisha. They're very similar, except that hookah is a little more crude than shisha is.
More harmful?
More harmful, definitely.
Okay.
But the principle is the same.
Okay. Vaping.
Vaping, okay.
Vaping is the safer thing, is what we've been told in
What
popular
we've been
media.
told. So there's it's a big disclaimer there that is what we've been told.
Very recently I was looking at this meme which said that couples who vape together stay together. It was floating around, right? Yeah.
Probably they stay together because they'll end up in the hospital together then.
Yeah.
So vaping, the new fad, the new fad of youngsters. It was in 2019 in Wisconsin, I think in the month of June or July sometime, when they had 5 youth who got admitted, 5 youngsters who got admitted to that hospital, and with unexplained pneumonia in both the lungs. A picture which is classically seen in COVID kind of patient that we saw now. This was in 2019 when they saw these kind of patchy opacities in the lungs on the X-ray, and they couldn't find a cause for it. In America, they would not just leave it like, okay, it may just be a viral pneumonia and it'll recover. But they went into the details of it, in-depth analysis, and they realized that all these 5 youth had history of vaping in the recent past. Within the last 90 days, they had been vaping. That is when they realized that vaping can be very, very harmful. After that, there have been many deaths that have been reported because of vaping. There have been many case reports of vaping-induced lung injury, EVALI, E-vaping associated lung injury, EVALI as we call it. 90% of the people who develop this kind of a problem land up in the hospital, because cigarette smoking damages you over years, vaping damages you instantly. We've also had youngsters getting admitted with these kind of unexplained pneumonias on the X-ray, which we kept figuring out what's happening. And pneumonias would still come with fever. These were youngsters who had come without fever, only cough, breathlessness, and you got a CT done. CT picture was patches in both the lungs. And when we took the history, again, in-depth history is very, very essential. And we realized that these 3-4 youngsters who came to us, all had been vaping in the recent past. So vaping can be very, very harmful. So 2 types of complications can happen with vaping. One is called the popcorn lung, and the other is called the hypersensitivity kind of a picture that you develop in the lungs, or an ARDS kind of a picture, or a pneumonia kind of a picture. So when it is pneumonia kind of a picture, it is related to one acetyl compound that is actually resulting in this. Vitamin E acetate or THC is what is called. And when it is a popcorn lung, popcorn lung basically comes from the word comes from in early 2000s, there were these popcorn factories where popcorns would be made, and they were using a particular chemical which is called the diacetyl. And they realized that while they were preparing these buttery popcorns, the diacetyl was actually causing harm in their lungs. They were landing up in the hospital with pneumonia-like picture, what we call as BOOP, bronchiolitis obliterans with organizing pneumonia. That's our language of, the picture that you see on the CT scan or the X-ray and the biopsy that you take. This is what was happening to them. So they have gotten away from it now. So in popcorn industry, they don't use that compound anymore. But this compound has now been added to the vape, the e-cigarette. So in the e-cigarette, they have this compound which is now causing damage to the lungs of whoever is using vapes. So vaping is equally or even more harmful, and the harms are seen immediately. Vaping can also cause harm because it has a battery in it. This battery can sometimes just explode and cause injuries. So there are injuries that have been reported because of the explosion of these batteries in the e-cigarettes that they have.
Okay.
So light cigarettes, light cigarette is another fad, another misnomer. They may be light in their nicotine content, but when you are addicted to nicotine, then you have to have that desired quantity of nicotine anyway. So then you tend to smoke deeper, and you tend to smoke more cigarettes than you would otherwise have smoked. So light cigarettes are equally harmful and again a fad. Pipes are probably 200 times more carcinogenic than smoking. So are cigars.
Cancer causing. Yeah.
So are cigars 30 to 40 times more cancer causing than cigarettes. Because again, in cigar, you tend to smoke it for much longer. It may be one cigar, but that lasts you the entire evening. And look at the size of the cigar as compared to a little teeny meeny cigarette.
Yeah.
So tobacco, inhaling in any form is harmful.
What about chewing tobacco, jarda? Because I believe that also impacts your lungs.
So that would impact lung because of some aspiration that goes into the lungs, then in the mouth. It can cause oral cancer, tongue cancer, jaw. So tobacco in any form is harmful to the body.
Okay. I'll come to the bizarre cases. 3-decade-long career. And I was speaking to Mansi, one of our very common friends, and she was telling me, he's one doctor who doesn't like his patients waiting in the waiting room. He gets very, very ired when he sees that. So in your 3-decade illustrious career, what are some of the most bizarre cases that you may have come across when it comes to people's lung health?
So let me start with narrating a case of a very young girl, 12 years old girl. She'd gone for an examination. Inside the examination, she was, while she was writing, I think she started to think, and the natural reflex is, you just put the pen into your mouth and just hold it in the mouth for a little while you're thinking.
Yeah.
And this was a ballpoint that she was using. Unfortunately, the back end also has a, rotatory cap kind of a thing on the back end. She just swallowed it. And when she swallowed it, it went right into her lungs and blocked her right airway completely. She had to be rushed to the hospital. Luckily, she came to our emergency. We took her up into our ICU immediately. We got an X-ray done. X-ray was showing complete collapse of the right lung because it had totally plugged the airway on the right side. The child was unable to breathe. You could hear that sound coming. So we immediately got our pediatric colleagues with us, sedated the child, did her bronchoscopy, and found this cap, the cap which was covering the end of the pen inside her right airways, and had to pull it out. It took us quite a while to get that out actually from inside.
Oh.
So these are just bizarre kind of cases that can happen. Another one was a 55-year-old gentleman who had gone out partying at a restaurant in Delhi, a very high-end restaurant in Delhi, partying and boozing as well. So after boozing, the poor guy developed pancreatitis the same night and had to be taken to the hospital. And while he was recovering from pancreatitis, 3-4 days later, his cough wouldn't go. His cough was not settling. And when we got an X-ray done, it showed that some part of the right lung had collapsed a bit for him. So we're only wondering, that what could it be? Probably it is some mucus plug because of the pain in the abdomen. He's not able to cough out the mucus plug, and that is why it is causing collapse. So natural reflex was to do a bronchoscopy. So we took him up for bronchoscopy. Of course, there was a lot of apprehension from the family as well as the surgeon under whom he was admitted. That Dr. Nangia, why are you doing a bronchoscopy? It's just cough, it'll settle down. I said, there's something amiss. The kind of sound that we are hearing when he's coughing is not classically just a routine cough. There's something more to it. And the X-ray is also showing some bit of it collapse. So there has to be something there. So again, when we did the bronchoscopy, guess what we found inside? There was a black pepper seed lying inside. The kali mirch?
The sabut.
Sabut kali mirch. It was lying inside his right side airways. And again, a part of the parting that he'd done that day before he entered the hospital with pancreatitis. Because probably at that time, under the influence of alcohol, he aspirated that black pepper, sabut ki sabut, into his lungs, and which was blocking and causing him cough.
Which reminds me of the recent Sanjay Kapoor case. They say the bee went into the windpipe.
And blocked it, yeah.
But there's a lot of
rumors about it.
Rumors,
Certainly,
conspiracy around it. Do you think that's even
truth.
possible? Like a bee?
It is.
Yeah?
Definitely it is. It could have gone and just blocked the upper airway. I had a friend's father who lost his life because of the, that fish bone, which he aspirated into his airways and he couldn't cough it out.
Yeah. Fishbone, understandable, but a bee can cause immediate death?
So maybe it caused some kind of an allergic reaction inside, anaphylaxis or something.
Okay. But it's plausible.
It's plausible, yes.
Okay.
So there was this gentleman who had retired from the Delhi University and had been coughing for almost a year and a half now. Had been to various doctors, had undergone treatment, but the cough wouldn't go. Finally, he went to a center just before coming to ours, where he got this bronchoscopy also done. And when they did the bronchoscopy, they found that the middle lobe on the right side was completely occluded. The entry to it was completely occluded, which appeared to be a tumor or a cancer to them. And they abandoned it because they didn't have the measures the instruments to do a biopsy. So he was referred to us for biopsy. So we took him up, we did the biopsy. When I was doing the biopsy, something just kept coming out. They were like nibbling coming out with the biopsy. What is biopsy forceps? Biopsy forceps is a forceps which when you put it inside through the bronchoscope, it opens up like a Y kind of a thing, and then you hold the substance that you're seeing or the tumor that you're seeing and then plug it and pull it out. So every time we would pull it out, there was some bit that would come out. And gradually we realized that we had opened up the entire airway. So we're only wondering, what have we done? I mean, it was a tumor and we seem to have resected the entire tumor, and we were very happy that, it seems that we've treated him for life now, that the tumor has gone out. But something wasn't very clear, there's something amiss there. So we sent all that material that we brought out for examination. And guess what was the result? The result was, it is only organic matter, which is very similar to betel nut. So supari. So it was a supari that had been lying in his lungs for almost a year and a half and causing him that cough.
How did it get him?
He probably aspirated it sometime. With age, your swallowing reflexes become weak. So you can just aspirate supari into your lungs. So, this is when you're entering into the airways, the main windpipe, then dividing into the right and the left. The left we bypassed, we've come into the right one now. In the right one, just below this is the opening of the upper lobe, and then this is what we call as the right main stem bronchus. So, which leads into the right lower lobe and the middle lobe. Just as the upper lobe bronchus after opening, you can see this blackish kind of a structure there inside.
Yeah.
This is what was obstructing the airways of this gentleman.
Okay.
And by the look of it, of course, it doesn't look like a tumor or anything.
What is it?
This was a supari that finally turned out to be. We kept pulling it out. We couldn't figure out initially that what is it that
But that whole white thing is a supari?
The whole thing. And it isn't something uncommon. Kaju, badam, supari, these are common things that people aspirate into their lungs and come to us with that.
Oh.
Tablets, pen caps, very, very often. Peanuts, peanuts, they aspirate into their lungs quite often. So these are common things.
Okay.
And then you need to, give them a little bit of anesthesia and pull it out with the bronchoscope. Bronchoscopes are also of two types, rigid and flexible. We prefer doing flexible for all patients because it's more convenient for the patient as well.
Yeah.
And also for us. And you see, after pulling it out, the airways opened up completely.
Wow. Yeah. But how is it white in color? The supari has
No,
something
white is because of the
accumulated?
mucus over it.
Okay.
It would have been brownish black, but
Right.
with the mucus accumulation over it, it looks like this.
Okay. So it must have been a big ball.
Huge.
Oh.
Huge.
Okay.
This would have been about 8 mm in size.
Oh my God. Okay. When we spoke on call earlier, sir, you mentioned that there was a very intricate connection between breathing and sleep and the quality of your sleep. Can you please tell us a little bit about this?
So I'm sure, as far as sleep disorders are concerned, sleep-related breathing disorders especially, if you read our old scriptures, the Vedas and all, there's a mention of sleep and sleep-related problems as well, which we probably ignored it over the centuries and years. If you remember Kumbhakarna,
Yeah.
he would just sleep for days together, would wake up, eat, and then sleep again. That was a typical pattern. So was that normal? It wasn't normal. There was a problem there. I don't know if you've read Charles Dickens' novels or not. He has mentioned about this character Joey, again, overweight guy who would practically be falling asleep during the day, eating, sleeping. So what was all that? That wasn't just somebody's imagination. That was something that they were seeing. They were observing, but they were not able to give a name to it. That what is the medical illness that they're suffering from, which now we realize in the last 3 or 4 decades, a lot of research has gone into it. The sleep medicine in itself has evolved a lot now. From the time that we started our practice to now, we see there are newer developments happening every day, every minute, literally. So people who snore very loudly, who keep tossing and turning in bed, people who do not wake up fresh or wake up in the middle of the night feeling choked, breathless,
Yeah.
or maybe waking up just to, going to pass urine and then coming back and sleeping again. But they never really wake up fresh, feel tired, exhausted, would want to catch a little nap for a little more while. During the day, feel tired, exhausted, fall asleep in meetings, especially in the second half of the day. They are suffering from what is called obstructive sleep apnea. What is obstructive sleep apnea? When they are sleeping, just, when you're lying down flat, what happens by gravity, your tongue tends to fall backwards. There's a uvula which tends to fall backwards. There are other structures in the throat, inside the throat, which tend to collapse inwards, which prevent the flow of the air. As long as it's a narrow flow, if you, know the principle of flute, the narrower it gets, the louder the sound becomes.
Okay.
So the narrower the passage gets, the louder the snoring becomes. And it reaches a stage where this passage blocks completely. So, the upper airways just choke completely or block completely, and there's no airflow happening. When there's no airflow happening, that is the time the oxygen levels in the body start dropping. As I told you, that 3 minutes is the time that maximum you can stay without breath. You can't be without oxygen for longer than that. So what happens then is gradually, when the airflow reduces, there is still some air going, there is still some oxygen going, but a time comes when it gets blocked completely, choked completely. So that is when the oxygen levels start dropping in the body. When the oxygen levels drop, then they trigger off an inflammatory cascade that can impact your brain, your heart, your kidneys, your lungs, your liver, pancreas, every organ of the body practically. So people who have these episodes frequently and the oxygen levels are dropping in the night, they would be very prone to developing heart attacks, heart failures, brain strokes, arrhythmias where the heartbeat becomes abnormal, uncontrolled diabetes, blood pressure. There can be sudden deaths that could happen when the oxygen levels drop down drastically.
Which is why a lot of people die in their sleep?
Exactly. That is exactly the reason why this happens. And this is not restricted only to adults but also to children, except that the manifestations are a little different. In children, they would manifest more like attention deficit disorder, the ADHD as we call them. They would be more restless, aggressive during the day. Their behavioral patterns would be different. Their performances in school would be poorer. But in adults, it can also result in impotence and accidents. There were so many accidents that happen in the middle of the night, practically because people fall asleep while they're driving. There have been accidents, air crashes, because when the pilots fell asleep while landing the plane. The biggest example is Bhappi Lahiri, our, the pop singer
Singer-songwriter, yeah.
in our country. He also died because of sleep apnea. And there's so many others. So people who have short neck, pot belly, overweight, BMI more than 30, collar size more than 16.5 inches, they are very prone to developing sleep apnea. So that is something that they should all get screened for and prevent themselves from various complications. If the oxygen levels are dropping down below 65% in the night, people could just develop arrhythmia, that is abnormal heartbeat. I've had patients who, while riding a scooter, a two-wheeler, would fall asleep at every traffic signal. That is the degree of sleep apnea hindrance and risks that it can cause.
Would the sleeping posture affect your breathing and subsequently sleep apnea?
So, very good question. All these patients, all these people or patients who have sleep apnea are never able to lie down flat because there's this complete obstruction of their passage, just by gravity. So they tend to sleep on their sides or they tend to sleep on their tummies. So posture definitely plays a very important role. Even in the management, when we had not devised the treatment or not found the treatment for sleep apnea, what would people do? They would tie tennis balls to their shirts in the night at sleeping, when they were sleeping, so that they wouldn't sleep on your back, on their backs. The idea was to prevent sleeping on their back so that they would always sleep on the side. So posture plays a very major role, but not that if you keep sleeping on your side, you can prevent from developing sleep apnea. It would reduce to some extent, but not go away completely.
Okay, so one of the tests for me to gauge whether I have sleep apnea or not is if I'm not comfortable sleeping on my back.
No, not really. I wouldn't say that. But yeah, if you can't sleep for very long on your back, if you snore loudly, you have a disturbed sleep, you don't wake up fresh in the morning, you feel lethargic during the day, then definitely you need to be screened for sleep apnea.
Which would be 90% of the people.
Absolutely. So if that is the case, then yes,
Yeah.
we should. And I wouldn't be surprised if it is.
Yeah.
Because let's not forget that India is the capital for diabetes, for blood pressure. Diabetes, blood pressure, they're all connected with sleep apnea. Sleep apnea would worsen your diabetes status. Diabetics are more prone to developing sleep apnea. So it's a vicious cycle that goes into. Sleep apnea is more common than we think. It's just that we have a total sense of denial towards it. In India, snoring is linked with घोड़े बेच के सोना.
Correct, humor.
अगर कोई खराटे लेके सो रहा है, so we call के घोड़े बेच के सो रहे हैं. But actually वो घोड़े जो हैं वो इतनी तेजी से दौड़ रहे हैं आपकी लाइफ के लिए that you can't even imagine that how harmful they're being to you.
If I am a recurrent snorer, then I have to get myself tested.
Absolutely.
Okay.
If your snoring can be heard across the wall, across the room, then you must get yourself tested.
Okay, because it could possibly kill me.
Absolutely. Besides being a reason for divorce in many families.
Yeah, oh yeah. Yes. What are some of the foods, sir, that you could recommend which can either improve my breathing capacity or better my lung health or would be beneficial for my respiratory tract? A, and B would be, so what are some of the foods that I should avoid?
Let's start with the foods that need to be avoided. That's simpler. That's
Yeah.
a shorter list. So actually there is no food that you should be avoided unless you know that you're particularly allergic to something. So the common food items that can cause allergy are milk, eggs, seafood, shellfish, prawns, then peanuts, tree nuts, and probably wheat, and to some extent soya bean. These are the common items. Again, whenever I talk about these food items, I am reminded of one patient who came to me once who said, Doc, I'm not able to figure out what am I allergic to. But every time I travel to Thailand, I develop this allergy, especially when I'm in the flight. So, and when I come back, I'm absolutely all right. But in the flight, it goes so bad that I am almost about to collapse. So, I couldn't understand what could be in the flight. Maybe it is the dust in the flight that's causing her the problem. This time she changed her airline and went by another airline and did not have a problem. And while in Delhi, when she was sitting in a seafood restaurant, she developed this allergy again. That is when we realized, and when we were discussing, we realized that it's the allergy to the smell of the seafood. The seafood that was being served on one of the airlines was causing her the problem. So the allergy can be so strong sometimes, and just the smell of it was causing her the problem. So these are the foods broadly that you should know can cause allergy and should be avoided. Again, as I said, there is no food in particular that can improve your lung functioning or lung capacity. But yes, it's good to, one, keep yourself well hydrated and well nourished. So when we say well nourished, of course, the usual high protein diet and an antioxidant rich diet, which will keep your immune system up. So now the question is that which are the foods that are rich in antioxidants? So if we start with fruits, You've heard of an apple a day keeps a doctor away. Yeah. So when you asked me this question on phone, I actually looked up, and there are studies and a meta-analysis that has also been published to see that what are the benefits of apple. And actually there are, that people who were eating apples on a daily basis, there are studies which have been conducted in the US, retrospectively, the people who are taking apple daily compared to those who are not taking apple daily. Those who were taking an apple daily were having lesser visits to the doctors in the year as compared to those who were not. But not necessarily for the lung, but certainly apple cider and apple juice are rich in antioxidants. Apart from that, the other juices as well, like the pineapple juice, watermelon juices, they're also rich in antioxidants. Coming back to the fruits that we were talking about, guava is rich in vitamin C, so obviously it builds up your immunity. All kinds of berries, raspberry, strawberries, blueberries, they're all rich in vitamin C, antioxidants again. Similarly, watermelon, rich in vitamin C. And so many other fruits, pineapple and all, they're all rich in antioxidants. Amongst the vegetables, I think broccoli, radish, carrot, cabbage, cauliflower, artichoke, asparagus, they're all very rich in antioxidants. Amongst the spices, if you actually want good antioxidants, the spices are rich in antioxidants, especially your turmeric, cumin, cinnamon, ginger, garlic. These are very rich antioxidants. I mean, I wouldn't say, take an excess of them, but yes, take some bit of it every day in your diet.
Okay. Rapid fire segment for you. Rate these from worse to less worse. Bidi, shisha, pipes, cigars, hookah, vapes, zarda.
From worse to less worse.
Yeah. I'll repeat that again. Bidi, shisha, pipes, cigars, hookah, vapes, and zarda.
Shisha, pipe, cigar, bidi, vape, zarda.
Okay, so from worst to less worse. When people have blocked nose, they use these Vicks inhalers. Is that safe?
So basically, again, it's like eucalyptus oil. Yeah. That's very helpful in opening up this nasal congestion. Vicks inhalers are also similar only. They're using some kind of herbs. It's just a strong smell that opens up the congestion. The only thing that you have to be careful is that you're not taking too much of it. Too much of this lipoidal thing going into the lungs can result in pneumonias as well. So you just need to be a little careful with that. Otherwise, they're safe.
Okay. So what would the frequency of using these inhalers be?
No, there's again no set limit to it. It's all individual and how much of it is going into the lungs. But for local use, yes, there's no harm. And we've used that. All of us have used that in our...
Is holding your breath a good test of lung health?
So basically holding, yes, to some extent, yes, I would say. If you're able to hold your breath, it tells you two things. One, the muscle power of your lungs, the external muscle that you're able to, inflate your lungs properly. And breath holding would tell you that there's enough oxygenation that is taken care of in the body.
Can lungs truly heal after years of smoking? And when I say heal, meaning heal 100%.
Yes, they can. But then after many, many years of quitting smoking.
If someone has 5 minutes a day, what is the single most effective lung practice that they can do to cleanse their lungs, to increase their lung capacity?
So basically, I feel what is important is doing deep breathing exercises. Pranayam, I'm sure you know about yoga more than I do. But exercises like Bhastrika, Alom Vilom, Kapal Bharti, they're all good for lungs. Apart from that, there are two kinds of exercises that you can do in a day, especially people who have underlying asthma and COPD and do get breathless. So to be able to control their breathing, at that stage they could do two kinds of exercises. One is a pursed lip breathing and the other is what is called a belly breathing. Okay. So they are quite helpful.
Okay, and how do you do the breathing?
So pursed lip breathing is about breathing very slowly inside and exhaling out more. So what you do is you sit upright, take a breath through the nose for about 2 seconds, breathe in, count 1, 2, and then people are used to making pouts, when they're clicking these selfies and all. So rather than pouts, you pucker your lips in and make it like a pursed lip, like as though you're blowing into blowing a candle or whistling. So you blow out slowly. So what you do is you sit straight like this, straight spine, low shoulders, neck upright, and then you breathe in, 1, 2, and then blow out. Count till 4 when you're blowing out. So this is one exercise which is called pursed lip breathing. Do that for a few minutes and that will really control your breathlessness. The other is called belly breathing, where you rely more on the diaphragm and the abdomen for breathing. So what you do again here is that you put one hand on your tummy and one hand on your chest and then breathe in. When you're breathing in, you ensure that this hand on the tummy moves forwards. And when you're breathing out, then the hand on the chest should be moving forward. So it's a reverse way of breathing.
Okay.
That again helps you take good breaths and help you control your breathlessness. One thing that I think we haven't discussed is about the impact of posture on breathing. Yes. So posture also has a huge impact. If your posture is not correct, the breathing capacity of the lungs could be reduced by nearly 30% in some patients, in some people, I mean. In fact, there are youngsters who come to us with breathlessness, that doc, I'm not able to pull in a breath, I'm not able to pull in a breath. And then when you ask them that how much is your screen time, the screen time is humongous. You can't even imagine. They're like on the phone, on their laptops, on their tablets all the time.
Yeah.
And when you're bending forwards, that's not the correct posture that you should be in. So as a result, your lung capacity goes on reducing. Think of it yourself. If you keep sitting like this, for how long can you sit like this? You can't. But if you're constantly on the phone, then obviously your lung capacity is going down gradually.
But what if I'm lying down and then scrolling?
Right. So even then, with your pillow up, you're on a pillow, you would be inclined. Yeah. So ultimately your neck is getting affected. So definitely it would cause a problem. So what the ideal posture would be: a straight spine, backwards shoulders, low and backward shoulders, and an upright head. That would give your diaphragm, which is the muscle that is dividing the abdomen from the chest, a proper configuration and the proper power to be able to counter the intra-abdominal pressure as well as the breathing. So for a proper diaphragmatic breathing that you should be doing, you should be sitting upright at most times with a straight spine and head upright. Posture plays a very important role.
Sure. And during sleep, what would you recommend is the ideal posture?
You should be sleeping flat on the bed.
On your back. Not on your stomach,
not on your back. So if you want to improve your oxygenation, then prone positioning would be better. As you would remember during COVID times, you would do a lot of prone positioning. That is, if you have a problem. Yeah. If you don't have a problem, then ideal would be to sleep on your back completely flat.
Worst posture, I think you mentioned, right? So sitting like this would be the ideal posture, not even reclined, I'm assuming.
Yes, absolutely.
Okay. What is that one non-negotiable rule for lifelong healthy lungs?
No smoking.
Okay. So myth or fact, pollution masks actually protect the lungs. Again, you've tackled it, but still.
Yes. So pollution mask would only tackle the particulate matter and not the toxic gases, which also form an important part of the polluted air.
Okay. Vaping is safer than smoking.
There is no question.
Okay. It's a
total myth.
Okay. Lungs naturally detoxify. I don't need any fancy products.
So lungs naturally detoxify would basically mean that you're breathing good air, good quality air all the time. Then yes, of course. And you're not smoking, you're not exposed to any kind of air pollutants, viruses. Then of course you don't need anything.
Asthma only starts in childhood.
Not necessarily. There's something called late onset asthma also, which develops in people when they are in 30s and 40s. And that is quite common these days. Especially in women, late onset asthma is more common.
In closing, my team has put this in. I was amazed to hear this, that in Delhi there are these oxygen bars that are being sold for 300 or 500 rupees for 15 minutes worth of oxygen. And then very recently I came across this individual who's also selling Himalayan air. So then, sir, in closing, my question is, what kind of a world are we looking at? Will we have to purchase clean air in the long run?
It is like saying that the all day long I will drink contaminated water.
Yeah.
And for an hour in between, or one glass, I'll take a filtered RO water.
Yeah.
So does that make any sense?
No.
It doesn't. Look at the amount of air that you're breathing in and out every day, 24,000 times, 500 ml of air. If you go for 15 minutes, that is like how many breaths in a day? I'll have to calculate that. I'm not so good in mathematics. But if you were to calculate, that would be just one fraction. For that fraction, you're breathing clean air. But what about after that? You're again going back to the same environment.
Yeah.
So I think this is just another fad that you're breathing Himalayan air or you're breathing pure air. It has no meaning, no relevance in real life at all.
But do you think there come a time that we'll have to buy and purchase clean air?
So I'm not sure whether we reach a stage where you have to buy or purchase clean air. But of course, air purifiers are there to your rescue. Masks are there to your rescue. And oxygen cylinders are there. If you reach a stage where you're having to be on continuous oxygen therapy, then yes, but there is no way that you can be buying air and keeping it. How will you even possibly store it?
Okay.
You can be purifying the air, recirculating it, but you can't be storing air, right?
Yeah. Thank you so much, Dr. Nangia. And the viewers don't know, but we share the same alma mater, modern school. Lots of memories, a huge part of our life and a very integral part of our life. So thank you so much for agreeing to be a part of this podcast. And it's been fantastic. You're so articulate. And there are so many insights that I personally didn't know before this. So thank you so much for sharing all of that with our viewers.
No, thank you so much for having me here. And I hope your viewers and you find this useful. I mean, all
Absolutely.
the tips that we've shared today.
Absolutely. Thank you so much. And please do comment below which one was the best tip that worked for you, which insight worked for you the best. Until next time, Pranam. Thank you.
Thank you.
In case you'd like to be a part of our online and in-person yoga, diet, and spiritual programs, you can join our WhatsApp group below, where we post all our upcoming programs and give free tips on health, diet, and lifestyle.